Governor Wes Moore wants to cut about $150 million from the state's current budget.
The governor wrote an op-ed in the Baltimore Sun this week saying the cuts are needed to cover costs for state-sponsored health care and child care programs that are expanding beyond what was budgeted. This comes as Maryland is projected to have a multi-billion-dollar budget shortfall in the next 5 years. At the start of next year, thousands of elderly Maryland residents say their health and wellness will be at risk.
And that's when state retirees are scheduled to lose access to their current prescription drug plan.
Tonight, Fox 45's Rebecca Pryor is sharing concerns from one retiree who says under the new plan, he would lose access to life-saving medications.
Yeah, it's a cost-saving measure for the state that comes at a time when the governor is promising to pump billions of dollars into public transportation and education. Meanwhile, the state retiree that I spoke with today says that this change could cost him his life.
This is Humalog.
As a 67-year-old diabetic,
Yeah.
every day is a fight to stay alive.
Oh, and I have a lot more in the refrigerator.
Among Ken Fitch's many medications,
I take that twice a day and
his insulin is the most critical
keep my sugar down.
and costly.
Right now, I get a 90-day supply for $50.
A price he's now fighting the state to keep from skyrocketing
Makes you angry.
under a new prescription drug plan.
It would be $2,000 to $3,000 for just one of these.
For 25 years, Fitch worked for the Maryland Department of General Services, a job he took with the comprehensive health care benefits in mind.
The only reason I took a cut and pay to go with the state.
But that state plan Fitch says he was promised, now scheduled to shift to Medicare Part D in just 6 months, at which point Fitch estimating his prescriptions will balloon from about $800 a year to $12,000.
Will you be able to afford that?
Maybe a year or so. I think I have to save money for a casket.
Is that the reality you feel like you're facing?
It's life or death, yes.
The potentially dire cost-saving change comes as Governor Wes Moore pledges to pump billions into his Kerwin plan and Baltimore's Red Line project. Fox 45 sending questions to his office today asking, do you support this change? If not, will you call on lawmakers to take action? And what is your response to retirees who feel their health and well-being isn't a priority for you? So far, no response, although previously his office telling Fox 45 the issue was out of the governor's control.
His hands are not tied. He's the governor.
Hoping for the best, but preparing for the worst.
Shorten your life real quick.
Fitch says he's considering rationing his medications.
This is oxycodone for extreme pain.
In case the day comes when he can no longer afford them.
How long I can last doing that, the Lord only knows.
Now, a lawsuit fighting this prescription drug plan change was recently thrown out by a federal court judge. Retirees have since filed an appeal, but are still waiting for the outcome. Reporting from the newsroom, Rebecca Pryor, Fox 45 News.
I'm Kai Jackson. Thank you for watching. Here's another video to watch. Also, please take a moment to subscribe to our channel.